I appreciate the evidence is there and delivered at the time that we were trying to make the decision for appropriateness of placement of care.
Yeah.
So whether we use it for pre-admission review in our ED, and the nurses there who use it for pre-admission to help guide the physicians in the decision about whether or not it's appropriate for an observation placement or an inpatient admission, or if indeed this may not be an appropriate placement in the hospital at all. We've also used the telemetry level of care guidelines. We embarked on a project, I think we started maybe in the fall of 2016 and finished in the summer of 2017, where we started with the telemetry level of care guidelines and put it before our cardiology committee and some other committees to try to agree on what would be appropriate use of our telemetry beds, because, as most hospitals, we have a finite number of telemetry bed resources, and we wanted to be more appropriately using that resource.
Yeah.
So we don't use the guidelines as they were presented in the product, because the physicians adopted them based on our community standards and practice patterns and what's available within the community. So it was a good jumping off point and has really helped us a lot.
That's great.
And we also used the NICU level of care guidelines. Last summer, we experienced an increase in our NICU. We have a level 3 CCS certified NICU. And we experienced an unusual increase in denials from our commercial payers. So it was odd. And when we did a little digging into it, a little root cause analysis, we discovered that something had broken between the NICU nurses reporting the level of care to our bed desks who put in the charges for the level of care. And so they were submitting all of the NICU charges at the wrong level. So of course, payers were denying. Made perfect sense when we figured it out. At any rate, we took the NICU level of care guidelines. I took it to our very receptive NICU manager, and she used it as the basis for retraining all the NICU nurses about what would be the appropriate level of care for level 3 or level 2 NICU services. And since that time, we have not had any more denials.
That's great.
Yeah. The process is working well, and as I said, it was very supportive, and they're very clear guidelines once people understand how to use them. So it was wonderful in how we did that. And then we have always used, since we've had the license for the product, we've always used MCG for our appeals, and have. I've been over the past couple of years retraining appeal nurses, and they have aggressively used the guidelines and the language from the guidelines in our appeals to support getting denials overturned. And I think we have about a 30% increase in our denial overturn rate associated with that, which is pretty good. We actually overturn overall a fairly high amount,